Hi, I'm Dr. Malcolm Butler, Chief Medical Officer here at Columbia Valley Community Health in Wenatchee, Washington. And I think you would be super proud to see the spirit with which our teams have pulled together to support the mission of this agency during the COVID crisis. We've done a lot of innovative stuff to keep our population safe and protected. We actually spearheaded testing out into some of the migrant farm worker housing facilities. We've worked very closely with our grower community and the local departments in the state towards safer working and housing conditions for our patients. We've developed novel methods to keep our patients safe. So, for example, we now have patients check in from their car. When their room is ready, we can then call them straight back so they don't have to wait in the waiting room. We've actually been testing for COVID-19 while the patient remains in their car. This allows us to protect other patients who might be exposed and also to limit the amount of personal protective equipment that we have to use in those activities. We built a testing facility within our building with a great big HEPA filter in it to keep, for patients who don't have a car, so that we can test them while keeping everybody else safe. We've even found a way to recycle our N95 masks. We bought a little oven and now we recycle them so that we're preserving our PPE. We took on contact tracing. And if you have thought at all about it, you will realize that contact tracing feels anyway to be very intrusive in a population who already has issues of vulnerability and not feeling safe. People of color, people who may be in this country without legal status, and having a phone call from somebody from the health district or the state Department of Health who may not have the language skills or the cultural humility required doesn't go well. And we've taken that on, and now contact tracing in our population, a population that already has a high degree of trust with us, is as simple as their primary care nurse giving them a call and asking them how they're doing, educating them about their infection, and checking in with who they may have contracted the infection from and to whom they may have spread it. And that's been going very well for us. As you probably know, telling people to stay home and stay safe is actually a terrible marketing plan. Our demand for care is down substantially. We've done a very good job flattening the curve, happily. Our community has stayed safe, and now our revenues are down by about 50%. We are now furloughing all of our providers and our staff for at least 1 day per week. And I'll tell you what I'm really scared about, and that is that just when this agency is the weakest it has been financially in the last 20 years, we are about to get hit by a tidal wave of the recently uninsured, the now unemployed and uninsured patients who have nowhere else to go. You know, we have done a great job managing this agency, and we managed to build up reserves. And right now we are fiscally healthy and we're doing fine. We're providing great level of care, but we are burning through those reserves. And if we get through those reserves just at the moment when we have way more uninsured people needing our services than we've had in recent memory, I think that's going to be bad. So please don't let that happen to us. Please join us in contacting our Congress people and supporting the federally qualified health centers and supporting all of the great work that our teams are doing. We can get through this, but we need to do it together, and I need your help. Thank you.